Good afternoon again. Thank you for joining us today. Without further delay, I would like to introduce the director of the School of Nursing, Dr. Shelley Bussard.
Hello, and thank you all for attending today. On behalf of the faculty and staff of the School of Nursing, we welcome you to our pinning ceremony at Bowling Green State University. I want to express my gratitude for your presence here today as we celebrate our newest graduates of the Bachelor of Science in Nursing program. I would like to present to you the class of 2025, joined by Professor Haley Giddis and Professor Marianne Mitchell, who are voted on as the students for the representatives. Class of 2025. Well, today we are here to recognize our seniors for all their success while in nursing school. I think it is safe to say that the past 2 years have been a bit of a challenging journey. And as you've learned how to become a nurse, you've completed skills, went to simulation labs, clinicals, theory classes. You've taken a lot of exams, taken a lot of courses, a lot of HESI exams. And I don't know if you knew this, but total hours that you've put into our program, and this is just 2 years. This is not counting all your pre-nursing work. So here you've spent 1,230 hours in the program. And with that, that includes 690 hours in the classroom, 235 hours in the skills and simulation labs, and 305 hours in the clinical setting. So if you've ever wondered why your family or your student wasn't around, that's why. So with all these hours behind you, all that countless studying, our next step is to pass our licensure exam and become that amazing nurse that you've always been dreaming of doing. And it just so happens that you'll be a graduate from Bowling Green State University. In your journey as a nurse, you will take care of people during their most vulnerable times, whether it be saving their life, to delivering a baby, compassionately caring for them, all the way to their last moments here on earth. And today we celebrate your accomplishments through our pinning ceremony. We have our keynote speaker, Joanne Navin, our Dean of College of Health and Human Services, Dr. Jim Ciesla, and our interim provost and senior vice president, Dr. Glenn Davis. We have student representative, Anna Lipinski. We have awards, recognition, and of course, your pinning. So what is a little bit about a history of pinning? It really began around 1860 with Florence Nightingale. And she was awarded the Red Cross of St. George in recognition of her time in the Crimean War. After that, hospitals began recognizing exceptional nurses by providing them with a pin. And today, nursing schools and colleges recognize accomplishments through the pinning ceremony. This also helps signify your membership into a society of nurses. And all of the nurses who are in this room have received a pin, and we wear them proudly. Today, we provide you with your pin and hope that you will also wear yours proudly. Saturday, you will graduate with your Bachelor of Science in Nursing degree. Soon after, take your licensure exam. And when you pass your exam, you will become one of the 25 million nurses worldwide. And I think I can speak for all of the faculty and staff and say, welcome to the profession. Congratulations to you all. Next, I would like to introduce our Dean, Dr. Jim Ciesla.
Good afternoon. It's so nice to see everybody. Let me start by welcoming our guests from off campus, family members, friends, and loved ones. You're most welcome to the BGSU campus at this important event. My name is Jim Ciesla. As Dr. Buzzer says, I'm the dean. Students, I'm your dean. It's a very, very proud moment for me to see you all here. As well, welcome faculty and staff. Thank you for being here. And most importantly, welcome students. There's a difference between an occupation and a profession and a calling. Nursing is most definitely a profession, but it's also a calling. The nursing profession is a calling because of the important work nurses do for people who are at vulnerable points in their lives. It's a sacred duty, really. Your role as nurses requires great technical skill, but most importantly, of course, empathy and compassion. Virtues you must always remember. Wear your pin with pride. Your faculty tell me you're ready to be nurses. Wait a minute, I think there's one more test you're going to have to pass. It's coming up here pretty soon. Good luck on that. I have great expectations. Family members and loved ones, thank you for the support you've provided to our graduates. Nursing faculty and staff, thank you for your dedication to teaching and to guiding these remarkable new Falcon nurses onto their path as nurses. I look forward to seeing you at commencement on Saturday. Now I'd like to introduce our Senior Vice President and Provost, Interim Provost, Dr. Glenn Davis. He's been a wonderful supporter of the nursing program, and I'm very glad to introduce him.
Thank you, Jim. Good afternoon, everyone. My name is Glenn Davis, and as Jim mentioned, I serve as Interim Provost and Senior Vice President here at BGSU. It is truly an honor to be with you this afternoon and to recognize and celebrate this year's nursing graduates, the class of 2025, so congratulations. We often talk, as Dean Ciesla just did, about nursing as a calling, as a profession rooted in care, in compassion, and in clinical excellence. And that's all true. But if I've learned anything from the nurses in my own life, and I've been fortunate to know several, what makes a great nurse isn't just the desire to help others, it's the ability to do so in moments that are sometimes chaotic and always deeply human. You have learned how to assess a patient, how to chart, how to insert an IV, how to spot symptoms that others might miss. But you've also learned how to keep showing up when you're exhausted, how to speak clearly and calmly when patients and their loved ones are afraid, and how to be a reassuring presence in the face of uncertainty when there's nothing anybody can really say to make it any easier. This takes intelligence and skill, no question, but it also takes courage and strength, the strength to advocate for your patients, even when it might be uncomfortable to do so, and it takes humility to acknowledge what you don't know and to keep learning and to keep asking questions. And it takes resilience because the hardest days, unfortunately, won't always wait until you're ready. But you are prepared to meet those challenges and not only find success and purpose, but even more importantly, to have a lasting and meaningful impact on your community. We believe in you. So to the family members, the mentors, the supporters, and especially to our outstanding faculty and staff in the School of Nursing and the College of Health and Human Services, who all helped you get here, thank you. And of course, to our nursing graduates, our class of 2025, congratulations. We are proud of you, we are grateful for you, and we are better because of you. Thank you, and we cannot wait to see you on Saturday. Take care, thank you.
Okay, next will be our keynote speaker, Joanne Navin. And Joanne graduated from BGSU with her BSN in 1976. She worked for several years with the Wood County Health Department, obtained her master's degree from Medical College of Ohio in 1983, which is now the University of Toledo Medical Center. Joanne completed the requirements to become a nurse practitioner and became certified in 1983. Her specialty was adult health and women's health. Joanne retired as Associate Director of the BGSU Health Center. Her accomplishments include being a former president of the Ohio Association of Nurse Practitioners. She was one of the original members and served as president while nurse practitioners were fighting for legal recognition and prescriptive authority. Welcome, Joanne.
Well, greetings. Can you hear me? Okay. I'm used to speaking in a lower tone of voice now. You know that I'm retired. I don't want to wake up my elderly friends, so we just have to be very quiet. It's amazing that I stand here and look at you, and I think that almost 50 years ago, I was in the second graduating class at BGSU in the nursing program. It's kind of hard to squeeze 50 years of nursing into like a 10-minute speech, but I'm going to do it as best way I can. Just to share with you how I happened along the route that I went. And I must tell you that it was very serendipitous. It happened. And I think the same thing is going to happen with you, because you are nurses, you care, you're bright, you're intelligent, and you want to do well, and you want to make things better. And that's where I came from. So as Shelley explained, I graduated in '76, went to work at Wood County Health Department. How did I do that? Well, the director of nurses happened to be the wife of my husband's chair in economics. So she said, "Oh, I need a nurse in public health. Would you like to come?" I said, "Sure." At the time, I was married. I had 3 children under the age of 10. Was a new resident in rural Bowling Green, had grown up in urban Cleveland, and it was quite a different aspect for me. So I worked 5 years. I worked as a home health nurse and then as a school nurse in rural Wood County. I would visit students whose parents lived in chicken coops along with the kids. I would visit elementary school children who were being abused. I would see populations. There was one doctor in rural Wood County, and these children and their parents had nowhere to go for care. And I developed a real passion for them. So I would have been there all my life, except budgetary problems came along, and the school nurse was the first to go. And those problems still remain, don't they? Some things never go away. So I thought, what can I do? And I had heard about this new movement that was beginning on the 2 coasts in the U.S., and it was called the Nurse Practitioner Program. And it was coming slowly, very, very slowly, to Ohio. And I thought, gee, that sounds like something I could do. I'm going to look into it. And so I did. And there was no nurse practitioner program anywhere in the northwest of Toledo area at that time. But medical college was new, and they were starting a Master's of Nursing program. So I investigated the whole thing, and I went to the Dean of Nursing, and I said, I would like to be a nurse practitioner. Would you let me make my program at MCO conform to the certification standards required by the National Organization of Nurse Practitioners? And she said, yes. So I sat about doing that, did my work, and my thesis, what was I going to write on? I decided I would write on young women and college-age women. So I came to the Dean of Students at BGSU and said, I'd like to use the Harshman dorm as my population, and they agreed. I wrote my thesis. I met a lot of people on campus. I also met the new medical director at the Student Health Service that was undergoing a big change. And I asked her if I could do my clinicals with her. She said, great. And when I graduated, she said, would you like to come to work for me? And I said, sure. So I got my certification as a nurse practitioner. I went to work at the Student Health Center. And the big problem was, what did they do with me? Because nobody knew what a nurse practitioner was. I would walk into the exam room and the student would see me and they'd say, Dr. Navin. And I'd say, no. My Dr. Navin is in the economics department across the street. You know, I'm a nurse practitioner, and then I had to go into my education of what a nurse practitioner was. And by the time I retired, I'll tell you, the students that came to me, they were going to be nurse practitioners. Their mothers were nurse practitioners. Their great aunts. I mean, it was amazing what had happened in the number of years between when I started there and when I graduated. I didn't graduate. I retired. That's right. Okay, so what happened? I had to find out how to practice. So I looked for other nurse practitioners in Ohio, and at that time, there were like, less than 400 of us. Maybe 5 in Wood County, maybe 15 in Toledo, Cleveland, Columbus, Cincinnati. They were the big ones. So we started a chat among nurse practitioners on the internet and texting back and forth. We decided that we needed to organize because there was one major problem. You thought, I should say there was another major problem, and that was, at that time, we were not legal in the state of Ohio. So even though I was a nurse practitioner, there were 2 nurse practitioners that were being sued by the Ohio Medical Association for practicing medicine without a license. So, well, that wasn't going to work for me because I had 3 kids and a husband. I really didn't want to go to jail. So I thought, well, we got to do something about this. So the groups of nurse practitioners that we started having bake sales. I would have bake sales at the health center for lunch and invite anybody that wanted to come, fundraisers. We even managed to hire a lobbyist on a shoestring. And we had lots of meetings with legislators, anybody that could meet with us. And one of my best memories, I think, is when Senator Radney Gardner, he was a state senator, we invited him to our meeting so that he could find out what we were. And so he came. That was really wonderful of him. But he didn't know who he was addressing. Talked a lot about medical doctors and health care and, wished us well, but he thought it was going to be a long, hard road. And then during the question and answer period, one of my colleagues stood up and said, Senator Gardner, I have to tell you, I met your children this morning. I did their school physicals in Dr. Lemon's office. And he was like, what? His introduction to nurse practitioners was on a one-to-one basis. He had no idea that his children had any idea that what a nurse practitioner was or did. So we moved along, and we got legislators to support us. We organized, and they elected me a president. I guess, I don't know, I think I was late for that meeting. And we did our best to put a good foot forward. We traveled all over the state. We worked with the Board of Nursing. We lectured about us. Anybody that we met, we would tell about us. We adopted the name of the Ohio Association of Advanced Practice Nurses, which included nurse practitioners, nurse anesthetists, CNPs, and I don't want to forget my cohorts here. There was one more. I'll think about it in a minute, and I'll come back to you. Midwives. How about that? How could I forget them? Okay. In 1996, the OAAPN was organized and became a professional organization. And while I was president in 1997, we were awarded title protection and legalization and certification in the state of Ohio. This was amazing. Now, there were tons of strings attached to this. And you know, when I look back and I think, but it was baby steps. You know, they were just watching us to see what we could do. And it was really good. Most of us worked well, and we worked with our physicians, but there was one stumbling block, and that was we couldn't write prescriptions. So back we were to the drawing board. What were we going to do about this? Because when I practiced, I could diagnose and I could find my problem. I could write the prescription, but the physician had to sign every prescription I wrote because the pharmacist couldn't fill my scripts. So we proposed to the Board of Nursing that they start a pilot program of 15 to 20 nurse practitioners in the state who could prescribe and see how it went. And I was privileged to become one of that group. And after that, prescriptive authority was passed in the year 2000 in Ohio, far behind other states, but there we were, and we did it. We didn't know what direction we were going in, but we got there. 2 years later, we were given the privilege of writing narcotics, and it has changed so much as I practiced. It was just unbelievable with the support of the Ohio Medical Association, the Board of Nursing. And I have to say that during all this time, I worked as a nurse practitioner at the Student Health Service. I had a medical doctor who supported me and precepted me and urged me along on everything that we did. I have to say that was, when I turn around and I look at everything that happened and everything we accomplished in that short period of time, I look back and wonder, how did it happen? And all I can say is it happened because we looked and saw a need. We said, we can change this. And we worked together to do that. And that's the advice that I would give to you as new graduates in the program. You have to be aware, you have to be ready to explore, you have to assess where you work. What do you like? Do you enjoy it? Do you love to go to work? Do you hate to go to work? Are there things that are not working well where you are working and you know they could work better? You need to speak up. You need to find other people that agree with you, and you need to go forward. Remember, nursing is caring, yes, but it's caring about many things. You have so many roads to explore. I think it's amazing, and I think it's wonderful. I wish you luck. You got to know National Nurse Week is next week, May 6th to the 12th. So, hey, you'll be able to celebrate it officially. And I also wanted to tell you that I did wear my pin today. I found it, and here it is. And I do wear it proudly. And I wish you all the best of luck, and I thank you for inviting me to speak with you today. Thank you.
Thank you, Joanne, for that wonderful, inspirational speech. I have worked with college students my whole career, and I always say my two favorite times are when students come in for orientation and when they graduate, because you see such a change. But you can see what people do once they leave here and do amazing things. And it's just the first 2 or 3 decisions you had to make, you just said, sure, right? It's saying yes and moving ahead. So thank you for that. Our next speaker is one of our graduating students. Faculty were asked to vote in selection of a student who has demonstrated professionalism and shown dedication to the Fellowship of Nursing, both for our program and for their cohort. Overwhelmingly, students and faculty nominated one student to speak. I am pleased to invite her to the stage. Please welcome Anna Lipinski.
Good afternoon to my fellow peers, School of Nursing faculty, family, and friends. I am honored to represent the cohort on this special day. This is a day to reflect upon our last 4 years, and more specifically, our last few semesters. As we are gathered here today, I, as I am sure all of you, are filled with an overwhelming sense of pride, gratitude, and relief for all that we have achieved. Nursing is vastly different from other majors. Our program was designed to teach the concepts in lecture, learn and practice the skills needed to respond to those concepts in skills lab, provide the opportunity to execute clinical judgment and skills in a safe environment and simulation, and then be able to confidently go out in clinical and practicum to work with real patients. Through this structure, we were able to form unbreakable bonds as we faced new challenges. Each day, we were tested on our knowledge and skill sets, as soon enough we will have lives in our hands, and it will be our responsibility to provide high-quality, patient-centered care for our future patients. As we near the end of this journey, I would like to take time to express gratitude to those who helped us along the way. To the faculty, we appreciate your unwavering support, dedication, and commitment to each and every single one of us. For the guests who maybe don't know, if you walk into any one of these faculty members' offices or on the second floor in the central hall, you will see that they will have a composite of each cohort so that they can recognize our faces and learn our names. We are so fortunate to have faculty who truly care about fostering connections with each of us. You've not only taught us the science and skill of nursing, but also the compassion, resilience, integrity that define what it truly means to be a nurse. Your dedication to our success, your patience through all of our questions, and your encouragement in our toughest moments of frustration, setbacks, and self-doubt have left a lasting impact and contribute to each of our successes. We carry your lessons with us as we step into this profession proud and prepared. Thank you for helping shape us into the nurses we are becoming, as it is because of your meticulous coursework, ensuring that we rise to the expectations set in the syllabi, and the extending boundaries of our endurance throughout the program that has made us better students and ultimately better future nurses. To our preceptors, we appreciate your commitment, time, and patience. You chose to take us under your wings and show us real and valuable experiences to prepare us for our future. Going into a field where it is a common saying that nurses eat their young is very nerve-wracking and at times discouraging for students as well as new grads. You have all exemplified patience, kindness, and understanding as you gave us the room to grow while we navigated skills and tasks that maybe we have never performed before besides on a mannequin. One day when we exhibit the similar skills and competency level, it will be our turn to help the next generation of nurses. To our friends and family, we wouldn't be here today without the love, support, and sacrifices you've made for us. To our friends specifically, thank you for the support and understanding as we navigated through the program, checking in on us after you knew we had an exam, being our camera person as we filmed checkoffs, and reminding us that it is okay to have a break and have fun. We needed that support, no matter how big or small of a gesture in the moment it seemed to you. It meant the world to us. To our family, many of whom who have contributed emotionally and financially to our success, and without it, today might not have been possible. Some of you were our first calls when we got into the program, got our first A on an exam, passed our first checkoff, performed a skill successfully for the first time at clinical or practicum, and many more. You have also supported us through the disheartening times, full of tears and worry. Know that we wouldn't be the people we are today without all the help that you have done for us. As I look around this room, I see not just my peers, but the future heroes of emergency rooms, delivery suites, intensive care units, medical surgical floors, behavioral health centers, and so much more. Maybe in the beginning, you thought about going into a specific specialty, but you have found a new love and excitement for another, and that is the beauty and flexibility of nursing. We all had a reason or reasons to go into nursing. A wise woman once said, "You may get your RN taken away, but no one can ever take away your bachelor's of science in nursing." We have worked so hard for this degree and those 3 letters behind our names. I urge you all to remind yourself of this, as well as why you chose to go into nursing, to stay motivated throughout your career. While pinning ceremony is the end of a journey filled with unforgettable experiences and defining challenges, we embark upon new beginnings, full of purpose, growth, and the chance to make a difference in countless lives. The best is yet to come. In closing, I will leave you with a quote from Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Thank you.
Thank you, Anna. That was wonderful, very heartfelt and encouraging. On behalf of the Student Nurses Association, 2 officers are going to share some reflections on senior year. So please welcome SNA President Hannah Tullock and Event Community Service Chair Catherine Klein.
Good afternoon. I'm Hannah Tullock, the president of the Student Nurses Association. Today is a wonderful day to celebrate all the hard work that was put into getting to this point. As we reflect on the last 2 years, I wanted to highlight what the Student Nurses Association members were doing in the community. It's hard and busy being a nursing student, but our members dedicated their free time to their community this year. In October, we held an event drive for an event called Tent City. It is a weekend-long event in Toledo for people who are unhoused or may be struggling to get the resources they need, such as medical and dental care, food, clothing, as well as other resources. After reaching out to a volunteer that worked repeatedly at this event, their biggest need was gently used jeans and travel-sized toiletries. So, we held an item drive and gathered 24 pairs of jeans and almost 200 travel toiletry items. We filled 3 moving boxes with supplies to be donated. In November, we partnered with the Red Cross Club of BGSU to host a blood drive. The blood drive took part over 3 days, and our members filled all of the volunteer spots. They helped with registering and checking in blood donors, as well as in the canteen area, ensuring people were eating snacks and drinking juice or water so that they weren't lightheaded. In December, the Student Nurses Association got busy bringing joy to our community. The board members of SNA put up the tree in the Skills Lab around mid-November, which may be early for some people, but we didn't just have ornaments and lights on our tree. Our art chair, Katie Nicholson, created 25 gift tags for the residents of Bowling Green Manor, which included items the residents were requesting, such as personal care items, blankets, fuzzy socks, entertainment, snacks, and drinks. Every single resident's gift tag was taken off the tree, and all of those residents had a gift waiting for them when the facility had their Christmas party. We wanted to spread joy to the residents since the holidays can be a very lonely time for some. So we got hot cocoa and brought our best voices to sing carols for the residents one evening in early December. One of the residents asked, "Are you guys with a church or something?" And we said, "No, we're just nursing students." By the end of the evening, and everyone had their fair share of cocoa, another resident asked, "So, when are you guys coming back?" It was a great evening and something we hope to continue in the future. In January, we collaborated with the Gift of Life Mayoral Registry to hold a registration drive. With just a simple cheek swab, we added over 25 people to the bone marrow registry over 2 days. The more people added to the registry, the more of a chance an adult or child with a blood cancer, such as leukemia, lymphoma, and other blood-related diseases can be matched with a donor for treatment. For the transplant to work, the donor and the recipient must be a tissue-type match, but matches are rare, so the more people we add, the more lives can be saved. In February, we partnered with Letters of Love of BGSU to hold an event where students could write letters to children in pediatric hospitals in the United States. Being future nurses and understanding how difficult it may be for a child to be away from their home and family, we wanted to spread kindness and love to empower the children battling serious illness. We wrote over 40 letters to be sent to these children. In March, we held another item drive, but this time for the Cocoon Shelter. The Cocoon Shelter provides shelter and advocacy services to survivors of domestic violence, sexual assault, sexual harassment, sex trafficking, stalking, and adult survivors of childhood abuse. Through our donation drive, we gathered over 100 items. These included items for the shelter, such as paper towels, plates, disinfecting wipes, and also for the survivors, such as toiletries and non-perishable food items. Overall, we should be very proud of our accomplishments and contributions to our community. Bowling Green State University is a public university for the public good, and I feel proud of our organization for their contribution to this mission. I would like to turn it over to Kate for her to discuss the other events SNA organized this year.
Hello, my name is Catherine Klein, and I've had the privilege of serving as the Event and Community Service Coordinator for the Student Nurse Association. I wanted to begin by congratulating everyone here today on achieving such an important milestone in our nursing school career. Being part of SNA has been one of the most rewarding experiences of my nursing school journey, and it's not just because I got to send a lot of please attend this event emails, though I did enjoy that. Through SNA, we not only participated in community service events, but we also extended our learning beyond the classroom and allowed us to respond to real-world issues through firsthand experiences with compassion and confidence. As a part of our continuing education, we had the honor of hearing Matt Bell, the CEO of Team Recovery, speak. His powerful story about addiction and recovery opened our eyes to the impact of compassionate nursing and how it can have an impact on patients overcoming addiction. For those who may not be familiar, Team Recovery is an organization dedicated to ending the stigma surrounding addiction. They work to educate, support, and advocate for those affected by substance use disorder. It reminded us that addiction isn't just a clinical diagnosis, but a human experience and one that affects families, communities, and lives in profound ways. We were not only reminded that addiction recovery requires not only medical intervention, but deep empathy and consistent support. We also took part in Narcan training with Joseph Wood, the naloxone program coordinator at the Toledo-Lucas County Health Department. We learned how to identify and respond to opioid overdoses. We talked about the signs of overdose, the proper technique for Narcan administration, and what to do in the clinical moments before emergency services arrive. We gained a practical skill, but also a deeper sense of responsibility. We realized that our responsibility as nurses don't start and stop at the bedside. It extends out into the world, into our neighborhoods, schools, and towns. We saw that being a nurse means being a public servant, an educator, and an advocate. When we're trained to recognize an overdose and carry Narcan ourselves, we aren't just prepared to help in the hospital, but we're equipped to respond anywhere. In an effort to explore career options after graduation, we invited Claire Tolick, an advanced oncology certified nurse practitioner, to discover the process of continuing education after becoming nurses. She discussed her path to becoming a nurse practitioner and how she found oncology, as well as many other topics beneficial to new nurses. During this talk, we discussed how to cope with losses of patients, trial and error with finding your field, and how to take care of yourself in a career that is focused on caring for others. For those of you that attended and gave them insight on how to further their education after graduation in a more specialized field and gaining clinical experience. In addition to continuing education, we also focused on professional development, specifically helping us prepare for the transition into the nursing workforce. We had the opportunity to collaborate with the BGSU Cooling Hub and offer resume building workshops to our SNA members. We brought in resume experts to help us walk through how to put 2 years of 12-hour shifts, preceptorships, leadership roles, and all of that fun stuff into one resume. Because let's be honest, nothing humbles you more like quite trying to make team player with strong communication skills sound unique for the 5th time. We were able to receive one-on-one feedback on our resumes and interview techniques for different nursing units and to help us stand out as new grad nurses. Following the resume building, SNA had the honor to host 2 career fairs this year. We were proud to welcome over 25 hospitals from across Ohio to our campus. Students had the experience to explore different specialties, learn about residency programs, and ask real questions to their future employers. Watching our classmates walk away with interviews and eventually jobs was one of the most rewarding parts of my SNA experience. Finally, the SNA board had the amazing experience of attending the Ohio State Nurses Association Conference in Columbus. Our SNA board connected with hospitals from all over the state, attended professional development sessions, and one of our proudest achievements was winning the NCLEX Bowl. I would like to thank the School of Nursing for providing us with the resource and knowledge needed to bring that trophy back to campus, but I also think it was our teamwork and slightly competitive spirit that helped us bring home that trophy. With that, I want to thank my fellow cohort for showing up and saying yes to growth. To our faculty and mentors, thank you for guiding us with encouragement and endless knowledge. And to all of our families and supporters, thank you for being the foundation during this journey. Thank you.
Thank you both for sharing your incredible experiences and the experiences of the Student Nurses Association that you coordinated this year. I was listening and I was remembering when Dr. Bussard was talking about all the hours that they were spending in clinicals and lectures and labs, and then on top of that, you were making a huge difference every month. It was amazing, so thank you for that. So now we'd like to take a moment or two to recognize students for their incredible achievements. This is the largest graduating class of BGSU nurses so far. And this record will stand at least for the next 2 years. You are all destined to be remarkable nurses with strong empathy and sound clinical judgment. Selecting recipients for awards was no easy challenge. I would like to invite the faculty representatives up for the awards and recognition. So please join us on the stage when your name is called to accept your certificate. On your way back to your seat, don't forget to stop for a photo. So I'm introducing Haley Geddes and Mary Ann Mitchell. Thank you.
We are honored, truly honored, to be standing here today as your co-representatives. It means so much to us that we've been able to walk alongside you through this journey from your very first day of nursing school and our very first day as educators at BGSU, both of us trying to look like we totally knew what we were doing.
We joyfully represent all of us within the School of Nursing who were graced with the opportunity to teach, guide, and support you as you navigated nursing school. We shared in your challenges and celebrations, your tears and jubilations, your disappointments, and the thrill of accomplishment.
But through every exam, every skills checkoff, every simulation, we watched you grow into capable, compassionate, confident nurses. You've worked so hard, and we are so proud of you.
Your ability to face each challenge, to lift yourself and each other in moments where what lay before you felt like a very high mountain to climb is a testament to each of you.
You supported each other, you learned, you persevered, and you reminded us every day why we love what we do.
Each of you arrived here with your own story to pursue this path. It is this purpose that paved your way throughout your education, and it will carry you in your care for each patient.
You've become more than students to us. You've become colleagues and in many ways friends. And now as you step into this profession, we couldn't be prouder to welcome you as our peers.
This is what we were like teaching, just to let you know. Back and forth, back and forth. Never forget the impact you have, even on the hardest days. You are making a difference. And as we look at you today, we can't help but feel you're all grown up now.
And so are we.
We believe in you completely.
Congratulations. We are so proud of you and so thankful to be part of your journey.
Congratulations to you. All right. So, we have several awards of recognition to present. Recipients, please join us on stage to accept your certificate when your name is called. So the first award to be presented is for the Cohort Fellows. These students were selected by their peers to represent this cohort for future School of Nursing events and ceremonies. They will also represent the class of 2025 as alumni. This recognition is awarded to Anna Lipinski and Cole Nemeth. We look forward to seeing you at future celebrations. Our next award is the Distinguished Academic Success Award. To be eligible, a student must have maintained a cumulative GPA at or above 3.5 in their courses here at BGSU. We have several students to celebrate. Our first student, Alexis Bornhorn. Our next student, Naomi Carl. Our next student, Emily Chisholm. Next, Emily Dunlap. Next, Madeline Feitner. Allie Finstermaker. Alexa Falk. Janelle Halterman. Ashley Hartzell. Aubrey Hollenbaugh. Sophia Cassandi. Andrew Kelb. Marina King. Bailey Lawrence. Anna Lipinski. Audrey Narhi. Cole Nemeth. Cadence Nicholson. Katie O'Byrne. Olivia O'Black. Emily Rife. Mackenzie Rail. Hannah Sudak. Hallie Smith. Camille Smith. Keegan Smith. Hannah Tulloch. And Dakota Zerman. To consistently maintain this high GPA as a nursing major is truly an incredible feat. Congratulations to each of you. Next, we will present our academic scholar for the class of spring 2025. This student held the highest cumulative GPA through the third semester of the BSN program. Congratulations to Emily Chisholm. Emily, your commitment to not only meet but exceed the daily demands of your education is an impressive achievement. Our next award is the Heart of Nursing Award. This student embodies the meaning of nursing. They display empathy in all situations, going above and beyond in terms of caring for patients, who listens to what is said or unsaid to help a patient and is respectful of each patient's backgrounds and concerns. This student is a team builder who creates a better patient care environment through strong leadership skills. The Heart of Nursing Award is presented to Ellie Finstermaker. Clinical faculty had this to share about Allie. Allie embodies empathy. In her assignments, she was able to connect pieces of information showing how well she listened to the patient and their family members during a time that was not easy for them. She approached patients and families with confidence, support, and respect, treating each person as if they were a member of her own family. Allie displays these qualities not only to her patients, but to her fellow classmates as well. Next, we have the Leadership in Nursing Award. The award recognizes the student who demonstrates leadership, one who motivates, mentors, and prepares other students to lead, one who participates and gives back in community activities and embodies the ethics and values of nursing. The recipient of this distinction is Anna Lipinski. Not only has Anna immersed herself in her nursing studies, but also in many extracurricular activities contributing to the development of her prominent leadership qualities. Anna's leadership will not be limited to the halls of a hospital, but to her community at large. With a heart of service, Anna has been part of many recruiting activities, including leading a group of prospective students at the College of Health and Human Services open houses, as well as volunteering for multiple summers in the college's nursing camp. The Professional in Nursing Award was a multi-way tie. Selected by faculty, these students exemplify professional standards and are positive role models possessing excellent communication skills and use evidence-based practice to institute quality and safety in patient-centered care. We have 4 recipients, and if each recipient, please come to the stage when your name is read. Naomi Carl. Florence Nightingale was referred to as the lady with the lamp lighting her path to care for wounded soldiers. Likewise, Naomi carries her own lamp within, radiating light, kindness, and positivity to all who cross her path. Naomi is the embodiment of joy. Her light will brighten and elevate her patients' lives, aiding in their healing and quality of life. Carly Dibling. Carly has a quiet nature, and there is power in her silence. The nursing world can be filled with noise, and Carly's ability to block out this noise shows in her decisive and focused nature. Carly's actions speak volumes, displaying her competence and capabilities. When she is at a patient's bedside, she embodies the ideal nursing student BGSU strives to create. Next, we have Delaney Kruger. With every class, skill, simulation, and clinical, Delaney has been leading by example. Delaney holds within her a high standard. Her kind and discerning nature has inspired and elevated those around her, both classmates and faculty. Her respectful and empathetic character will set the tone in not only her future workplace, but her community at large. And finally, our fourth recipient, Cole Nemeth. Cole has been developing his professional nature since he set foot on campus. As the undergraduate student trustee on BGSU's Board of Trustees, thank you, Cole. Cole has been committed to advocating for students to ensure their voices are heard. There is no doubt he will be able to transition his role as advocate for each patient he cares for, guiding, supporting, and enhancing the quality of each patient's care. Congratulations to Naomi, Carly, Delaney, and Cole. Our next award is the Excellence in Clinical Practice Award. Students were nominated for this award by the clinical faculty who taught our seniors throughout the program. The Excellence in Clinical Practice is presented to Emily Reif. Emily is exceptional in her clinical practice because she demonstrates all the qualities of this award. She displays outstanding clinical skills, a superior ability to develop patient and family rapport. She's committed to patient education, an advocate for patients, has high ethical standards, displays excellent communication skills, and does all of this in a calm and confident manner. In short, Emily breathes nursing. She selflessly takes all the challenges of nursing and meets each challenge with an unwavering commitment to the highest standard of patient care. We are now to our last award. And this is the Exemplary Clinical Judgment recipient who was selected by faculty based upon their ability to exhibit effective noticing, interpreting, everybody now students, responding and reflecting, and using these clinical judgment skills to make decisions regarding patient care. This student demonstrated outstanding skill performance and reflected on actions to improve their practice. The recipient of this award is Olivia Oblak. There is a thought within nursing that clinical judgment is either learned or it comes naturally. As Olivia's first clinical instructor, it was clear this came naturally for her. However, Olivia never wavered to continue to develop these skills and grow into them with each concept and experience learned. Olivia never stops questioning to seek a deeper understanding so she may practice the best patient care she is able to offer. There is no doubt Olivia has learned the skill of nursing. However, it is her commitment to reflection that will make her nursing care an art form as well.
So congratulations to our 2025 award winners. All right, we will now begin the pinning portion of our ceremony. Students and their pinners will join Dr. Lisa Jacobs, who's our simulation lab coordinator, and Dr. Annette Oberhaus, who's our assistant professor, on stage to receive their pins. On the screen will be the student's name and where they plan to work after graduation. Please hold applause until all students have been called.
As our students are lining up, good afternoon. We thank you all for coming here today to celebrate and join with us. It's with great pride that the entire faculty of the Bowling Green State University School of Nursing awards each of you your nursing pin. The pins you received today officially welcome you to the profession of nursing and signify your commitment as a BGSU graduate as the public university and your commitment in serving the public good as healthcare professionals. So without further ado, Josie Anderson. Jared Beckstein. Alexis Bornhorn. Kamara Brown. Courtney Brown. Caitlin Burnham. Naomi Carl. Adam Cartwright. Paula Chindavong. Emily Chisholm. Ashlyn Kramer. Loren DeLeo. Carly Dibling. Kara Deshawn. Emily Dunlap. Jacob Everly. Raven Farnsworth. Madeline Feitner. Ellie Fenstermaker. Alexa Falk. William Fulmer. Bryn Gardner. Irma Jean Golden. Madeline Haynes. Janelle Halterman. Ashley Hartzell. Grace Heitkamp. Aubrey Hollenbaugh. Chloe Jaffe. Sophia Cassandi. Andrew Kalb. Helena Katakis. Marina King. Catherine Klein. Savannah Kroll. Delaney Kruger. Caitlin LaGrange. Bailey Lawrence.
Where's my saying? Yes, but where is what I'm supposed to say at the end? Anna Lipinski. Thank you. Samantha Menpaw. Amanda Mantle. Alec Mate. I practiced.
Claudia McKinney. Grace Haley Lynn Metz. Kendall Michaelis. Kendra Miller. Elise Murasan. Sarah Murphy. Audrey Narhi. Cole Nemeth. Cadence Nicholson. Katie O'Byrne. Olivia O'Black. Zach Price. Gabrielle Repko. Emily Reif. Olivia Riggs. Mackenzie Rail. Ashley Shepard. Audrey Simpson. Zion Singletary. Hannah Sudak. Hallie Smith. Camille Smith. Kaylee Smith. Keegan Smith. Megan Solon. Matthew Stewart. Hannah Tullock. Lauren Vaughn. Paige Vertus. Samantha Wagner. Heidi Wenson. Jocelyn White. And Dakota Zerman. The faculty congratulates each one of you on this amazing accomplishment, and we appreciate all of you who came today and has helped your student and has played a pivotal role in supporting them in their new role as nurses. And now we are going to welcome Dr. Buzzard back to the stage.
All right, that was exciting watching you guys all come across. I loved it. Congratulations. All right, so I would like all of our students and any nurses, current nurses or retired, to please stand. If you recall, back in August for our students, we had our lamp lighting ceremony, and at that time we said the Nightingale Pledge. So as we finish up our educational journey, I'd like for all of us to redo our Nightingale Pledge, and all of us that are nurses, current and retired, if you can also say the Nightingale Pledge as well. Okay, and it's up there on your slide. I pledge myself here to practice my profession with integrity. I will strive to maintain and elevate the standard of nursing, both as a science and an art. I wholeheartedly recognize the importance of high standards of care and of personal accountability. I devote myself to the healing, protection, and welfare of those committed to my care. I accept a duty to work for the improvement of health in the communities in which I live and work. I will hold in confidence all personal matters committed to my keeping and will respect the privacy of medical information. I will act in compassion and ethical manners. I will not knowingly administer or consume any harmful substance. I commit to interdisciplinary collaboration and lifelong learning. I fully acknowledge the seriousness of the responsibilities that I accept in my calling and the significance of this pledge that I take today. Very nice, thank you. Well, congratulations to all our graduating students, and as you can see from this ceremony, how very proud of you we all are. Not only the faculty and staff, but your friends and family that have joined us today. I thank you all for attending and supporting our students through this monumental time. And lastly, as we finish our ceremony, we're going to ask that all of our seniors will recess out of the ballroom with our faculty professors, Professor Giddis and Mitchell. All of our pinners can stay here in the ballroom, but we'll ask for the students to rise and follow Professor Giddis and Mitchell that are over here. And the rest of our families and friends, we have some snacks in the back that you can stay and enjoy some food. Thank you all for coming.